Hi, my name is Courtney Wu, and I'm a registered dietitian. Today I will be presenting my Institutional Review Board proposal for the study of the effects of weight loss and vitamin D supplementation on serum vitamin D levels in obese adults. I will be reviewing the introduction of the topic, the purpose, background, and significance of the study, as well as the methods and procedures and results, and concluding. Obesity has reached epidemic proportions, as the prevalence of obesity has reached to almost over 1/3 of adults in the United States. Coming close is vitamin D deficiency, as it still remains a global concern. The two are related because the fat-soluble vitamin plays a role in multiple metabolic functions. Some of these metabolic functions beyond bone health include calcium and phosphorus homeostasis, cell differentiation, proliferation, and growth, and muscle function. It is also said that vitamin D plays a role in blood pressure regulation, immunity, and pancreatic B-cell protection. This fat-soluble vitamin is stored in adipose tissue, which may give insight to the prevalence of vitamin D deficiency seen in obesity. A deficiency of vitamin D may lead to osteomalacia, which is a softening of bones. But beyond osteomalacia, because vitamin D plays a role in several metabolic functions, it is important to address the deficiency and search for potential treatments to treat the deficiency. This leads to the research question at hand. Will a combination treatment of vitamin D supplementation and weight loss positively affect serum vitamin D levels in obese adults? A review of the literature thus far reveals a study reviewing obesity and vitamin D and the correlation. This review revealed a randomized controlled trial of 77 overweight and obese adults. The intervention group was given 1,000 micrograms of vitamin D. The result the researchers saw was a reduction in fat mass and also a significant improvement in serum vitamin D levels. And other researchers reviewed the randomized controlled trial of 97 overweight and obese adults who were given either 50 micrograms or 150 micrograms of vitamin D as a supplement. The researchers saw a significant improvement in serum vitamin D levels. Additionally, researchers conducted a randomized controlled trial over 52 weeks studying the impact of a high dose of vitamin D in patients with vitamin D deficiencies prior to the bariatric surgery. The aim was to correct the deficiency prior to surgery. The researchers saw serum vitamin D levels had actually dropped at 26 weeks and then fell below normal after 52 weeks of the high-dose supplementation. This leads to a systematic review of randomized controlled trials and non-randomized trials, reviewing vitamin D levels and weight loss. Researchers found in the review of the studies that there was an improvement in serum vitamin D levels in those who were randomized to the weight loss group. The purpose of the current study is that review of previous research has revealed that the previous studies have addressed vitamin D deficiencies in obese adults and have researched into possible mechanisms for deficiency. However, it is the purpose of this study to assess the effectiveness of vitamin D supplementation and weight loss in improving serum vitamin D levels in obese adults, as the treatments thus far primarily revolve around supplementation. Another aim of this of this study is to provide insight into further research regarding the correction of vitamin D deficiencies, hoping that this study will produce positive results. Therefore, the hypothesis at hand is that vitamin D supplementation combined with weight loss will improve serum vitamin D levels in vitamin D deficient obese adults when compared to the control group. The significance of this study, again, is that it will provide potential treatments to extend beyond simply supplementation. Hopefully, it would also provide insight into future research and an improvement in overall health for the participants. The methodology of this study is, the style is a randomized double-blind parallel study over the course of 12 weeks. Participants will be randomized into one of two groups, the intervention group and the control group. Intervention group will receive vitamin D supplementation, weekly weight loss counseling by a registered dietitian, and participate in exercise at least 3 to 4 times per week. Control group will receive a placebo, but also receive the weekly weight loss counseling by an RD, and also participate in exercise at least 3 to 4 times per week. Participants will be recruited by phone, referrals by healthcare professionals, and in person at Huntington Hospital Outpatient Center. Interested individuals will complete a pre-study questionnaire to aid researchers in determining whether or not these individuals meet the criteria for this study. According to a G-Power a priori independent means t-test calculation and a medium effect size and a power of 90, the sample size needed for this study is 140 individuals. Due to potential attrition rate of 20%, this has been increased to 168 participants. Inclusion criteria include adults over the age of 21, obese with a BMI of greater than or equal to 30.0, and a vitamin D deficiency of less than 20 nanograms per milliliter. They will also be consent. Exclusion criteria include individuals currently taking vitamin D supplementation and those who are unable to provide their own transportation to the outpatient center and on-site laboratory for questionnaires, laboratory draws, and anthropometric measurements. Measurements and data collection include anthropometrics, which height and weight, BMI will be calculated, biochemical, which include serum vitamin D levels, and a 24-hour dietary recall, which will be administered by a trained registered dietitian, an exercise log, which will be self-reported by the participants. All measurements and questionnaires will be taken at baseline and conclusion of the study. Selected participants are those who have been invited by the researchers, having met the criteria from the pre-study survey, will attend an orientation to hear about the methods and purpose of the study, as well as the benefits, which include to gain insight into treatment methods for correcting vitamin D deficiency, but also an improvement in overall health and a correction in vitamin D serum levels. Participants will be ensured that their confidentiality will be maintained, as no identifying information will be shared with any personnel outside of the researchers group and the statisticians. All data will be collected and stored in one laptop, and those researchers and statisticians included in the study will be the only ones who have access to the material. No identifying information will be shared with any outside personnel. The research setting, participants will primarily be in their free living home setting, but the questionnaires and laboratory measurements will be conducted at the Huntington Hospital Outpatient Center and on-site laboratory. Upon the conclusion of the orientation, if participants have an interest in participating in the study, they will sign the informed consent. No participant will be allowed to participate in the study without signing the informed consent. All interested parties will also be presented with information about the study and researcher contact information. Upon the conclusion of the study, and once all of the data has been collected, the consultant statistician will complete analyses. An independent t-test will be run to assess for differences in weight and changes in serum vitamin D levels, and also determine significance of those values. Pearson's R coefficient will assess the correlation between the weight loss and the serum vitamin D levels. There are minimal risks to participating in this study, but a potential adverse effect from increased exercise and activity may be a risk, especially for participants who were sedentary or did not participate in as much activity prior to participating in the study. Benefits of participating in the study include that this study is minimally invasive, requiring only 2 blood draws, and another benefit will also include a contribution to existing research in healthcare surrounding vitamin D deficiency and obesity, and hopefully all will achieve a benefit of improvement in overall health upon the conclusion of this study. Purpose of the study is also to impact the dietetic profession, as it may help guide vitamin D supplementation recommendations for dietitians, and it may also provide potential additional methods of treatment for vitamin D deficiencies beyond supplementation alone. Goal is also to impact the dietetic profession by providing insight for further research. Thank you very much for your attention, and thank you much for listening.